All right, well, good afternoon, and thank you for hanging around to talk about child health. You know, I want to link back with the previous conversation, and we think about intelligence. I talk to Alexa every morning, and as a pediatric nurse, I think she knows me. This morning she said, "Good morning. Today is the first day of fall, and you should go jump in some leaves." So I loved it. I was like, that's exactly what I want to do this morning, Alexa. So I'm here to talk about the power of synergy. So we're going to use a term called synergy to emphasize community partnerships and how to bond with the community and those that are already moving forward in community management, particularly of child health. So we're going to talk about child health, and as a nurse for 20 years, I've had a lot of experiences to partner to work with child health in various aspects. And last fall, when I walked on to the loveliest village on the plains, that's exactly what I saw. I saw partnerships already in the works. I saw students engaged in technology and discussions. I saw faculty engaged with each other, with other disciplines. And around this campus, this loveliest village on the plains, we already have a lot of partnerships in motion. So we have psychology. We have nursing, we have VCOM, we have nutrition, we have social work. We have so many already moving in child health management. So I want to address some of those today, and I want to talk about how can we continue to work in synergy. So this slide is about the population of children and where we are today in population. You clearly see a boom around 1960, 1965, and you can remember the baby boom, or you can have discussed this in previous classes or with each other. And we're going to continue to see this projection with children increasing over the years. And right now, 2016 data shows that 23% of the population are made up of children. And that's children 0 through 17 years of age. So why is this important, and why does this impact child health? And we'll see, it's not going to work right now, but I'm going to tell you about don't worry about it. I'm going to tell you about a show called Inside Out. Emotions. Inside Out deals with emotions, and it's 5 emotions: disgust, fear, joy, anger. And we can work with each other in synergy, and that's exactly what this clip is doing. So I'll make sure to try to point this clip out for you and for those that are watching. But what it does is it shows how inside our emotions work together to have one common theme, and that is, for Inside Out, an 11-year-old girl and the decisions she makes. So the quick video was showing her being fed broccoli and all the emotions the first time she was fed broccoli, and how we can work together in management of child health. So let me tell you what I do. I look at child asthma. It's one of the most common health conditions with children, affecting about 8% of the population, and there's a clear disparity with child health in asthma. We see about 13% of our non-Hispanic Black population affected by asthma. We see about 7% of our non-Hispanic Caucasian population or white population affected by asthma. And we see about 16% of our Puerto Rican Hispanic population affected by asthma. There's a clear disparity. And while overall it's about 8% of our school-aged children living with asthma, that disproportionate greatly affects the children in the state of Alabama. We see it in the school systems. We see them missing school. We see their parents missing work. And an average of 5,000 people die each year from asthma, and it's been pretty plateaued. What it does is it causes a constriction inside the airways, and this constriction can lead to a lot of complications like coughing or wheezing, shortness of breath, and if left untreated, it can completely close off the airway. What do you see here with this data? I'm looking at data from 1997 to 2015, and we see a plateau. We don't see much change no matter what treatments we've implemented with child asthma. So we've implemented a lot of treatments like steroid use or daily use of medications, yet the numbers continue to be the same. So working together, how can we make a difference? Well, we have some research initiatives going on right now We're looking at education, working in the school systems, and it's not alone. We need to work in synergy. So right now, nursing is working with psychology. We're working with nutrition. We're working with disciplines throughout Auburn University campus to help educate children and families. We're starting asthma camps. And in all, we're looking at specific outcomes like asthma morbidity, ER visits, hospitalizations, school days missed, and parent work days missed. So next year, I plan to come back and tell you about some of the outcomes that we have. But it's not just within the state of Alabama. We have developing partnerships with other states, Texas, Florida, Wisconsin. We have also implemented a new education with the American Lung Association, and we're trying to get the education in multiple states. So Auburn University is at the forefront of working with various states to implement educational opportunities. But I can't move on before talking about the state health of child outcomes in Alabama. There's significant problems. There's great numbers that are continuing to rise when it comes to obesity. Last year, Alabama was the second worst state to when it comes to obesity numbers. Now, we have improved a bit. We're now third. And I'm happy to report those numbers, but that means we're making progress. So child obesity continues to rise. We have got adult hypertension and obesity rates that are higher than ever. So we're setting our children up to fail. So what can we do in synergy to help make these changes? How can we work together with multiple partnerships to have a combined effect greater than an individual work? So what I want to do is work together to make changes in the state of Alabama, specifically with child health. So I want you to look at this busy slide for a minute. What this does is this slide paints a picture of where we sit with economic and health disparities. And I will show you the third line that's black. Those lines, all from the black line up, are all led by single parent homes with a mother present. Those rates are 60 to 80% living in poverty. So how can we make a change in child health without addressing poverty? When I came to Alabama, which was just a little while ago, I came in December, the first person I wanted to meet was Dr. Wayne Flint. He's well known in this area, and he is who New York Times calls to find out information about Alabama health. And Dr. Flint told me one thing. He said, for you to make a change, you have to address poverty rate in the state of Alabama, because you cannot make a change with asthma management or any other child health without addressing poverty. So let me just show you what makes up the impact of different factors on risk of premature death for our children and our adults. Genetics makes up 30%, access to health care makes up 10%. So where do we need to devote our time? Look at the social and economic factors at 20% and the individual behavior, which makes up 40%. We can make a change with that 60%. So how do we do it? I suggest synergy. I want to highlight that Alabama is greatly affected by poverty rates, and depending on the source that you take a look at, our children are living in high poverty rates across the state. It's worse when you get into the rural communities. I've had a chance to visit a lot of the rural communities and those around us with Chambers County, Barber County, Russell County, a number of other counties that are known as the rural counties of Alabama, and poverty rates are greater than ever. So I want to ask you, what does synergy mean to you? How can we work together? Why is it important in an organization? Because I think Auburn University can be a leader in child health. And I just encourage you and challenge you from this day forward to partner. There are people that want to partner, and let's make this a continuous loveliest village on the plains. Thank you so much.